On November 14th, the FDA commissioner released a statement warning people about kratom. I'm going to run through problems with the FDA's position and problems with those opposing a ban. The overall message is that there's evidence of harm and no evidence of benefit. In support of this, the FDA cites a significant rise in kratom-related calls to poison control centers from 2010 to 2015. It also cites 36 fatalities associated with kratom-containing products. Details of those deaths were not released, so they could have involved adulterated products or mixing it with other drugs. Given the evidence, those reasons are pretty likely. Potentially, kratom-involved deaths can be found, but they usually involve extra substances. I'm inclined to think that's also true here. There's evidence the drug can be harmful due to CNS depression and a higher seizure risk, yet pure kratom overdose deaths are exceedingly rare. The idea that kratom is a supremely concerning substance causing a wave of fatalities across America is not supported. There are multiple problems with the statement. First, it's overstating the harms, especially when viewed in the context of other opioids. And second, it's a bit disingenuous when it suggests anecdotal evidence of benefit is of absolutely no use. This is nothing new for the FDA and the federal government at large. It appears to presume all drugs are guilty to the point of criminality until millions of dollars are spent running randomized controlled trials. As the commissioner says, to those who believe in the proposed medicinal uses of kratom, I encourage you to conduct the research that will help us better understand kratom's risk and benefit profile so that well-studied and potentially beneficial products can be considered. In the meantime, based on the weight of the evidence, the FDA will continue to take action on these products in order to protect public health. Those actions include cracking down on companies that inappropriately market kratom and calling for the detainment of shipments. The government has been taking these actions for years, so it's not surprising to see this letter. What is concerning is that it may indicate there will be a push towards prohibition. Advocates prevented emergency scheduling in 2016, but the DEA did not lose interest in the plant. Instead, it asked the FDA to review the evidence and make a recommendation. If its evaluation suggests kratom is a harmful, abusable drug with no known medical use, we could see it become a prohibited drug. Sadly and expectedly, that's how the agency is characterizing the substance. Kratom is currently receiving more attention than salvia divinorum, another substance the DEA treats as a drug of concern. Because of that attention and more alleged safety issues, a federal ban is conceivable, whereas action against salvia has seemingly stopped at the state level. At the least, more state-level kratom bans could be triggered by the sort of rhetoric coming from the FDA and others. There are many reasons to dislike prohibition. One is that it's a fundamentally wrong-headed and inappropriate exercise in government power. Another is that the drug in question is not just a recreational substance. It may be a tool in the fight against the opioid overdose crisis. There are no randomized controlled trials, but we know people are using kratom as an opioid agonist therapy. They're taking it to control the withdrawal symptoms from opioids like heroin, to reduce craving, and to increase their chance of leading a better life. Even without studies, I find it hard to believe switching from heroin or illicit oxycodone to kratom isn't a net positive. It appears significantly less likely to produce fatal respiratory depression, and the dependence it produces is less severe. When you consider the adulterants, like fentanyls, in the illicit opioid market, there's yet another reason to support the switch to kratom. But the FDA has a different take. At a time when we have hit a critical point in the opioid epidemic, the increasing use of kratom as an alternative or adjunct to opioid use is extremely concerning. It's very troubling to the FDA that patients believe they can use kratom to treat opioid withdrawal symptoms. This idea really doesn't make sense. None of the evidence indicates the use of kratom as an alternative to other opioids is concerning. If anything, it's the opposite. The FDA also dislikes it being promoted for other uses. uses, including pain relief. However, animal studies and anecdotal evidence from humans show it can reduce pain. Since a core part of its activity is acting as an opioid, that's not surprising. Though I do think there are reasons to be cautious about using it ahead of other drugs. It is, after all, a minimally studied concoction of minimally understood drugs. Perhaps it's a good alternative to typical opioids, but we need more evidence. Regardless, a lack of controlled trials isn't a good reason to ban it. The FDA and DEA have a negative view of the plant based on the potential for addiction, death, liver toxicity, seizures, insomnia, weight loss, and hallucinations. Kratom may have a connection to at least most of those issues. For example, animal studies show some potential for liver toxicity, and we know people can use it in a compulsive or reckless way. But none of the evidence suggests it's common for a kratom user to destroy their liver, become psychotic, or die. Focusing on outlier events is a good way to demonize a drug, and a bad way to create policy or educate people. If you look closely at most pharmaceuticals and over-the-counter drugs, you'll find uncommon risks that, if elevated for political reasons, would make it seem like those drugs should be banned. Kratom is no different. Though I'm not fond of the FDA statement and I oppose a ban, the arguments from the pro-kratom side are often flawed. I understand the reasoning for those bad arguments, but I still don't think they're ethical. The largest advocacy group for this topic, the AmericanKratom Association, is misleading people about the nature of the drug. In fact, it claims it's not even a drug. This is a pretty strange position to take. Sure, if you engage in some mental backflips, you can say the plant isn't a drug per se. There's no kratom molecule circulating through your body, but the only reason the plant does anything is because it contains drugs. This is why coca, coffee, opium, cannabis, the areca nut, and psilocybin mushrooms are also called drugs. The AKA also says this: kratom contains no opiates, but it does bind to the same receptor sites in the brain. Chocolate, coffee, exercise, and even human breast milk hit these receptor sites in a similar fashion. It's accurate to say the primary drugs, mitragyny and 7-hydroxymitragyne, aren't opiates, but neither is fentanyl. The broader class of drugs people actually care about is opioids. Sure enough, that's the best classification for these substances. By extension, kratom can be viewed as an opioid, meaning two things. One, it exerts its effects, like morphine, through the mu-opioid receptor. Two, it offers morphine-like effects, such as mood enhancement, pain relief, and sedation. Not only is kratom a drug, it's an opioid. But guess what? There is absolutely nothing wrong with that. People seem highly resistant to this view of kratom due to unfounded concerns about opioids and the general idea of drug use. The plant does have a more diverse pharmacology, extending beyond opioid agonism, but opioid activity is at its core, and the comparison to exercise, coffee, and breast milk is laughable. Unless you're going to say taking heroin is like going for a swim, let's not say drinking kratom is like high-intensity cardio. Countless things activate the endogenous opioid system, such as endorphins and enkephalins. But these kinds of ideas show a disregard for the science and how drugs are classified. The AKA and many others also focus on the fact that kratom isn't a synthetic substance. They say it's just a plant in the Rubiaceae family, just like coffee plants. This is true, but why does it matter? Plants are not inherently safer or more effective than synthetic drugs. They're just biosynthetic machines pumping out chemicals like a naturally occurring Pfizer laboratory. Every substance, whether it's created in the lab or found in a jungle, has to be evaluated on its own terms. Otherwise, this is just the fallacy of appealing to nature. The AKA says kratom is not a synthetic substance. Naturally occurring kratom is a safe herbal supplement that's more akin to tea and coffee than any other substances. Yet the fact that it's not synthetic tells us nothing about its safety or efficacy, and the outright categorization of it as safe is dubious. Harm reduction is necessary just as it is with other drugs. It's also misleading to claim it's closer to tea T than any other substance. It doesn't function like caffeine, and users tend to report opioid-like effects. Even if those effects are comparatively mild, saying kratom is more like tea than an opioid makes little sense. The same sort of position was shared in a Pro-Kratom article. It is used as a natural alternative to pharmaceuticals to manage a wide range of physical and mental health conditions. Due to its anxiolytic and analgesic properties, it can mitigate all manner of conditions. The author goes on to say, it's also an effective panacea to mental health conditions and can be used as a cognitive enhancer, study aid, and enjoyed for pleasure. Again, highlighting its status as a natural drug is engaging in a specious appeal to nature. And if you want to stand in opposition to the FDA, it's probably best not to tout something as a panacea when you have little research to back it up. None of this is to say kratom cannot be a good alternative to prescriptions for many people, but these kinds of statements from the AKA and others are misleading. If you're trying to fight propaganda from the FDA, DEA, and other authorities, I think it's best to counter with facts and honesty, not falsehoods. There are potentially good reasons to support kratom as a treatment for opioid addiction and other conditions, and we should be encouraging careful, scientific evaluations of its activity so that users are more informed. Sadly, a ban could still be coming. I can picture the FDA and DEA saying it should be heavily researched before anyone uses the drug, and while those trials are underway, it'll be controlled to enhance public safety. Yet banning the drug would limit research, hurt people with opioid addictions, and expand the unacceptable policy of prohibition. Restrictions can and should be opposed with those arguments, not with more misleading statements. If you have any questions, feel free to put them in the comments. The Drug Classroom is only funded by donations. This content is possible due to listener support. If you want to support, you can do so through Patreon, PayPal, or Bitcoin.